Welcome everyone to our show today. Today we have our guest Hanisha Patel. She's a licensed naturopathic doctor with a background in pharmaceutical sciences who specializes in integrative fertility, thyroid disorders, and gut health. And Hanisha is also the founder of Mahan Health, a naturopathic practice based in Columbus, Ohio, in the US. Hanisha, welcome to Dr. the Podcast, and we're super excited to have you here today.
Yes, thank you so much for having me. I'm so excited to be here with you all.
Welcome, Hanisha. And to start off our topic today, we are always trying to cater to our audience, and we are, all of us in this call or in this recording are part of that target audience, which are females that are, we are quite familiar with hormonal imbalances. And looking at all the different hormonal glands, we notice that the thyroid is usually overlooked. And as a reflection, according to the American Thyroid Association, they estimate that 20 million Americans have some thyroid disease, and up to 60% of them are unaware of that condition. So this is just reflective of how we kind of overlook this very important hormonal glands. And so it would be interesting to get your take on this topic for today. And so to start off, maybe you could start explaining what the thyroid does and then draw into hypothyroidism.
Yeah, definitely. Yeah, like you said, thyroid disorders affect so many people. It's about, with that stat, it's like, I think it's about 1 in 5 women, 1 in 7 or 8 men. So it is pretty abundant within our culture and our society in general. And so it is something that definitely needs to be addressed. And so starting off with what the thyroid does in general, one of the best ways that I can explain it, and I think I actually got this from a little medical cartoon where they consider the thyroid the king, right? So the thyroid is the king or the queen of our bodies. It literally controls everything. We have thyroid receptors on every single organ of our body, and so that's what's going to literally control how so many of our organs work. And so if our thyroid is out of balance, that can affect our digestive system. It can affect our hormones, what we're going to talk a little bit more about, like our reproductive hormones. It can affect our ability to get pregnant, our fertility. It can affect our bone health, our cardiovascular health, our neurological health, our brain health, our mental health. Literally everything, every aspect of our health can be impacted by our thyroid because it pretty much controls everything. So it is probably, I mean, I hate to say it's there's any organ that's more important than any others because they're all very important, but it's definitely a very significant organ that we have. And it's just this little butterfly shaped gland that's right around our throat. And the way that it usually works is in an optimal setting. The way that it would work is you would get signals from your brain. So it would go from your hypothalamus in your brain to your pituitary gland, which is kind of around here. So which is all in your brain. And then that pituitary gland will send signals to your thyroid gland to produce thyroid hormone. And that thyroid hormone is then distributed to the rest of your body as needed and wherever it is needed. And so that's a very simplified version of what your thyroid does, because it, like I said, it literally does everything.
And what happens to the body, or like what's the impact on the body when the thyroid isn't doing what it's supposed to do?
Right. Yeah. So like I said, it can control pretty much everything. Every organ in our body can be affected if the thyroid is out of balance. And so I think the main thing we want to talk more about today is hypothyroidism. So I'll go a little bit into hypo, and I'll briefly go over hyper, but we'll stay focused a little bit more on hypothyroidism. But essentially, hypothyroidism is an underactive thyroid. And so what we're seeing is that the signals that your brain is sending to your thyroid gland either are not being converted properly, or you're just not producing enough. And so that is where we see the underactive thyroid. So oftentimes we have the TSH, which comes from our brain, and then the free T3 and free T4, which comes from the thyroid gland and then is distributed. What we see with hypothyroidism is the free T3 and free T4 are much lower. Free T4 is abundant in our body. Free T3 is what's actually active in our body. So when we lack energy, which is a very common symptom of hypothyroidism, that's because we don't have enough free T3, and that T3 is what gives us that energy. It's the active part of our thyroid hormone. And so with the hypothyroidism, you'll have less free T3, free T4, and then because you have less of that, that keeps sending signals to your brain, be like, we need to produce more thyroid hormone, we need to produce more thyroid hormone. And then what's in your brain, the TSH, that gets stimulated and that keeps going up, but there's some sort of disconnect going on right now. So now your TSH is really high, but your free T3 and T4 still don't there's still not enough of it. And so that's what's happening with hypothyroidism.
So if I understand correctly, because there's a lot of TSH and T3 and T4s. So if I were to understand correctly, what produces TSH? Is this correct?
TSH, that comes, it's TRH. So that's thyroid releasing hormone that comes from the hypothalamus, and that goes to the pituitary gland and produces thyroid stimulating hormone, which is TSH. And then that tells your thyroid gland to produce the free T3 and T4, which are thyroxine. Hormones.
And so because it's underperforming, because your thyroid is underperforming, the rest is the other receptors, or the ones that are hormones supposed to signal the rest of the production of the free T3 and T4, they are just heightened, but there's like the production is just not happening. Is that correct? Exactly. And so what happened next? Because what's that gap of having too much of those indicators that are supposed to produce those free T3 and T4?
Yeah, so that is actually, so when we do lab testing for hypothyroidism, the main test that most doctors do in conventional medicine is just the TSH. And so when we see that TSH is elevated, that's when we know that there's some sort of imbalance, because the only way it would be so elevated is if we're not producing enough of those free T3 and T4 hormones. And so that is how we would know, essentially.
And having too much of them, is there another impact? Does it impact your body in a certain way?
Oh, yes, definitely. So, and that is, so what is more of an issue, I would say, than having too much of the TSH is not having enough of the free T3 and T4. Because when you don't have, especially the free T3, because that's the active hormone, that's the one that is sent to all of your organs to support, like I said, there's a thyroid receptor on every organ. So that's where the free T3 goes, and it connects there. And then it tells that organ to function in whichever way it needs to function. When you don't have enough of those hormones, that's when we can see more of the way I like to put it. So this way, we would say that it's a slow or sluggish thyroid, right? So that's what hypothyroidism is, because you don't have enough of the free T3 and free T4. The way I like to put it is, when your thyroid is slow, everything else is slow. So that means your digestion is likely slower, which means that you're probably feeling more constipated. Your energy is lower. You're probably feeling more fatigued. Most people end up having more depression over anxiety, and because everything is just slowing down. So that's kind of like the best way. Also, your periods are likely irregular, because again, those hormones are slowing everything down. And so that's kind of the way, the easiest way I like to think of it is just like, when your thyroid is slow, everything else is slow.
Right. And I think you touched on a good point where we wanted to kind of highlight that, like, what is the impact? Women go through many different stages in their lifetime. And so, in adolescence, or when you just get into get puberty, and then when you want to prepare your body for pregnancy and have children, and then later on when you have menopause, what is the impact on the body when you have hypothyroidism at those different stages?
Yeah, I love this, because our hormones are constantly changing as women, right? They're constantly shifting and changing throughout our life cycles. And our thyroid is also constantly shifting because of that, because our thyroid impacts our reproductive hormones, but then our reproductive hormones also impact our thyroid. So there is this bidirectional effect. And so So starting with puberty, that's like one of the biggest first transitions that we experience as women, what's really going on is estrogen estrogen is being stimulated. So we're having a lot more estrogen, and then this can stimulate the thyroid growth in general. And so this is something that can impact the thyroid as well. So if we're not having enough estrogen, then we might not have enough of the thyroid tissue. If we have too much estrogen, we might have too much of the thyroid tissue, which could lead to more of an enlarged thyroid gland.
So this is the opposite of hypothyroidism, right? It would be hyper.
So hyperthyroidism would be an overactive thyroid, essentially.
So this is where you would see a bigger gland here, and because the only time I've been, in touch with what a thyroid is because I've seen someone with quite inflamed thyroid, and so I guess that signal is an hyperthyroid.
Not necessarily. Not necessarily.
Interesting.
So we can see an enlarged thyroid with both hypo and hyperthyroidism.
Okay. Interesting. And why is that?
So it's just because there's constant activity going on there, and usually it really just indicates inflammation of the thyroid in general. And so sometimes what we'll see, so with hypothyroidism, for example, when we have an underactive thyroid like that, and the autoimmune component, which we haven't gotten into, if we have the autoimmune component where your thyroid gland is actually attacking your immune system is attacking your own thyroid hormone, which is actually the most common form of hypothyroidism. When that is happening, that can lead to inflammation in your thyroid, which can cause it to be enlarged, but that can also lead to degeneration of your thyroid in general. So I'm sure a lot of women have probably heard of women who've had to have their thyroid removed. And that is what often happens. So it can happen kind of either way.
Interesting. So sorry, because I kind of interject and try to understand if there was a link between hyper and hypo, but we were talking about at adolescence where you were saying there's a higher production of estrogen, and it can affect the way thyroid could be produced. Is it usually at that point of time in the adolescence, puberty, when you hit puberty? Is it when there's an underperforming or overperforming thyroid?
Yeah, so because you're having this kind of intense estrogen, progesterone release in your body when you go through puberty, because you're having that it does increase your risk, or just it increases your thyroid activity in general, because those hormones can impact your thyroid. So it depends on the person how it's impacting them. We're talking more about hypothyroidism, so that with that, it can actually, with estrogen, it can stimulate the thyroid to make more of the thyroid hormone precursor, so that TSH. And so we could be producing more and then not enough of the free T3, free T4, or the opposite, essentially, and where you're not having enough estrogen. And so that's something we'll see with, for example, conditions like PCOS, or if young women don't actually start their period ever, right? That's something that could actually be because the thyroid is already out of balance, right? That is something that we would need to address during puberty or even before, because it's definitely very possible that their thyroid has already been affected and out of balance, and now the thyroid can't keep up with the hormonal shifts, and that's why the hormonal shifts are actually not even occurring, or they're occurring abnormally.
Right. So I guess for someone who is in their adolescence and they don't know if they have a thyroid issue, this would be like a good indicator if they haven't gotten it and they're like 15, 16, for example.
Yes, definitely. Yeah. So that's something, usually young women will reach puberty around, it's getting earlier and earlier because of our environmental factors, and we won't get into all of that. It's definitely getting earlier and earlier, but we'll see from 9 to 13, 14 is pretty common on average. And so within that time, so by, like you said, around 15, 16, or even 17, if we're not seeing them have either a regular period or they are not having a period at all, that's when we would want to definitely assess their thyroid to make sure that their thyroid is optimal.
Right. And would that be like, not having a period or having very irregular periods, would that be like an extreme, imbalance of your thyroid, like an extreme hypothyroidism situation? or
I
is it?
wouldn't necessarily say it's extreme. I think it can definitely happen. And there are a lot of women who do experience that. And I think what would be a little bit more extreme, if anything, is not having a period at all. That is definitely less common. Would be a little bit more extreme in terms of the impact that the thyroid might be having on their hormones. But irregular periods are so common, and especially if someone has hypothyroidism. The most common causes of having thyroid imbalance even before adolescence, which can lead to these abnormal hormonal shifts during puberty, will actually be things like gut dysfunction, going through some sort of trauma or stress, like chronic stress as a child, vitamin D or iron deficiency. Those are very common. And then even a high dose or longstanding history of antibiotics and steroid use. So if a child has been using a lot of antibiotics and steroids, that can definitely increase their risk of having more thyroid complications, which will then lead to complications during puberty as well.
That's a really good point to highlight, I think, because I think people feel clueless, right, when they are in that stage, and you're like, but I haven't been doing anything unusual. So I think thank you for highlighting that. And so yeah, you were mentioning about puberty. And so how does it look like for women who are, for example, preparing their bodies to have babies?
Yeah, so actually when we go through puberty, technically that's what we're doing, is we're shifting our bodies to prepare our bodies to actually have babies. Of course, we don't want to have babies so young when we're 13, 14, or even, I mean, it's up to everyone for them to decide, but we usually don't want to have babies in our teens and early 20s anymore, right? That's definitely shifted in the cultures, which used to be very common for women to have babies around that time. But that is the shift that's already happening. And so in terms of fertility, when we think about fertility, starting from puberty up until you actually conceive, that time period is actually what we're looking at. That whole period is the fertile stage. Actually, technically, your whole fertile stage is not just till you conceive, it's till you hit menopause, right?
I'd like to throw in a small caveat here. What about because as you said, we are not necessarily getting pregnant when we get our first periods, and we usually go into contraceptions and we start taking the pill, etc., and which kind of alters our hormonal production, etc. And so say we get off the pill, have you encountered female clients that having issues with, kind of getting off the pill and their thyroid?
Oh, yes, definitely. Yeah. So the pill has a lot of adverse effects that are more subtle, and therefore not addressed conventionally really at all, because it's pretty much, a lot of times conventionally it's like, you didn't die, right? So you're fine. And that's not that's not how I operate. So or you're not in extreme pain, so you're fine. But what the pill does is it does deplete a lot of our vital micronutrients. So it depletes a lot of our B vitamins, our vitamin C, selenium, zinc, magnesium, and all of those are essential in optimal thyroid production. So when we're on the pill, we are already negatively affecting our thyroid in general. And so post-pill, we'll see a lot of, I actually have seen a lot of women who will experience post-pill PCOS, polycystic ovarian syndrome, which can then also affect your thyroid, or your thyroid can also affect that, right? So everything can affect one another. It's all interconnected. And so we'll see that quite frequently. And what's going on with the pill, often it is suppressing your thyroid. It is suppressing your thyroid hormone, leading to a potential higher risk of hypothyroidism. The complicated part about the pill is that so many young women are given the pill at like 13, 14, maybe even 12 years old. And so it's hard to know if they actually had imbalances prior to the pill, whether it's their thyroid or PCOS or whatever. We don't actually know. And so afterwards, we don't know all often we don't know if it was actually the pill that caused it or they already had some imbalances.
Mhm.
And so really we can only tell if, a woman has gone through her menstruation cycles a few times, like, she started her period when she was 13, but didn't go on the pill till she was 20. And then we
Oh,
see
wow.
things have shifted after when she gets off at 26, let's say, using that as an example, she gets off at 26, all of a sudden she has those symptoms of an underactive thyroid or PCOS, where before when she was 14 to 20, she didn't have any issues. And so, so that's when we can really see if the pill is actually the cause or if it's a combination.
Yeah, I mean, the point of course, of us talking about it is that the pill is something that in our modern days sometimes cannot be avoided, and it's part of how we can, for women to feel a certain sense of control in their life. So we're not, I think I'd like to put a small disclaimer. It's like, we're not here to judge, but it's more like it is altering some in some ways, and it's just for us to know how and not be surprised when it does. And I guess that there are solutions, as you said, there are always solutions. Great. And so usually, what is the recovery period from, that someone who's been taking the pill and who's off the pill and might be, experiencing readjustments with regards to the thyroid? Usually, if you do take action, usually how long does it take to kind of get back on normal?
Yeah, so it really depends on the person. It really depends. There are some people who just go right back, right? And that's great, and that's that can definitely happen. And there's some people it can take up 1 to 2 years. So it really just depends on each individual person. And I will say, I will say that outside of the pill, there are other options. If the goal is to prevent pregnancy, there are definitely other options. And of the more invasive options, I usually recommend more of the IUD, just because the non-hormonal IUD, because it doesn't have as many of the adverse effects in depleting our nutrients. But there's also the fertility awareness method and things like that. One of the things I will say I'm completely against is using the pill to regulate hormones, because that is not actually getting to the root of the issue. It's actually just suppressing the problem. And then when you get off the pill, you still have those issues, if not worse.
Yeah, that makes sense. And I guess, okay, so tying that in, and from getting off the pill and that journey, what about women who are in in their menopausal or perimenopausal stage? What does a hypothyroid having hypothyroidism do to their body?
Yeah, definitely. So as we shift, so this is the other big shift, right, to menopause. As we shift to menopause, now there's a decrease in those hormones that we originally had an increase in, right? The estrogen and progesterone were going up before, now they're going down. And so with them going down, again, that can affect your thyroid, right? Those hormones are going down. That's affecting your sending signals to your brain to produce less thyroid hormone, because now we don't need it to produce that estrogen and progesterone. And so, so that can impact your thyroid, but then also vice versa too. So if you already have hypothyroidism that's not well managed, then we can see how it impacts your estrogen progesterone production in general, and maybe it might even suppress it almost completely, where you don't actually have much of the hormone left at all. And that's when we'll see a lot of those postmenopausal symptoms or perimenopausal symptoms, like hot flashes, vaginal dryness, low libido, all of those things. And so we still want those hormones throughout menopause and postmenopause. We just want less of them. And so it's about working with our body and shifting. A lot of times it's shifting our lifestyles with these cycles too, because it's not going to stay stagnant. It's not the same. Even our diets can be a little different. We do better with different diets during different times of our life. And so yeah, kind of working through that. But that's essentially how either one, the menopausal suppression of those hormones can impact your thyroid, or your thyroid can impact how you transition into menopause. There is a smoother process. And so that's going to be, like I said, with the diet and lifestyle, like those are big shifts. oftentimes during our fertile years, when we are menstruating, we're bleeding out once a month, right? So we're releasing a lot of iron that way. And so often during those fertile years, we actually do much better with having more meat in our diets in general. But then during menopause, we actually want to shift into probably a more vegetarian or plant-based diet in general, with less meat, because now you're not bleeding out as much. And so transitioning there, but then also your workouts and things like that. So likely because everything else is slowing down, you want to slow down your workouts. So things like walking and yoga are great, but you probably don't want to be doing as much like high intensity. That's where I see a lot of my women who are transitioning to menopause and who are doing like high intensity workouts. They continue to gain so much weight. And that's because all their hormones are slowing down their production and they're trying to ramp it up, and it's just you're not working with your body, you're working against it. And so your body kind of rebels, and it's just like, I don't know what to do with all this excess stress, and it turns it into fat. And so so that's one of those things that I always try to recommend for my patients is like, as you transition, you want to change some of these lifestyle habits. If you haven't been moving at all, you really need to start moving too. Walking is super, super helpful and important. And like I said, yoga too can be very powerful.
Yeah, it's very interesting. What I've kind of remembered is like you have to adjust your lifestyle to your life cycle, right? And so it's the transition to change that is the stress factor, and sometimes where the resistance comes from, because people don't like to change, isn't it?
Right. And that's and I think that's one of the issues with our society today, is that we try to, I mean, even if we look at celebrities too, like we try to do this like anti-aging, like change in general. So like women are supposed to look the exact same way until they're like 80,
Right.
or if they don't, then they're forgotten, or they don't matter as much anymore, right? And this idea is all really messed up, because we're supposed to change. Our bodies are meant to change. And that's the thing. Maybe a little waking during menopause or post-menopause is actually normal and okay, right? Like because your body is there to support you. But we're so afraid of like we want our 19-year-old body for some reason, which is like not even realistic, right? So understanding that that's okay to shift and change, and that's right, like the only constant is change. And I think it's accepting that change in general. I think that's a big part of all of these transitions.
So now that we've been talking about, the changes that we experience with hypothyroidism at the different stages of our lives for women, what can women do today to support themselves or their family members or friends that are experiencing hypothyroidism?
Yeah, that's a great question. So in general, as like I said, retract that. The first thing I'm going to say is the first thing that I think is the most important is the mindset. So it's something that we were just talking about, right? Accepting that change is inevitable, and it can be beautiful, and that's how we can grow and evolve. And so I think the mindset is really, really important in helping supporting us through all aspects of our journey, right? This journey called life, accepting that, and then in working on our mindset in general to be like, we can get through this, and I don't need to suffer through this. And so that's why I know I talked about how I'm against that anti-aging movement, but I am pro aging gracefully. That's what I am a proponent of, is that we can age without pain. We can go through that. And I I'm still pretty young. I'm only 30, but I know people who are in their 90s and even 100 years old, 80s, 90s, 100 years old, who feel great still, right? And that is, to me, that's the goal. That's how I want to age. Is I don't care what I look like, as long as I feel good, as long as I want to keep dancing and moving and living my life and enjoying it. And that's what I see with those people. And and I think that starts with the mindset. And so that's the first thing that I'll say, is like, let's always keep working on our mindset. The next thing would, of course, be working on our lifestyle, right, in general. So the nutrition, movement, stress management, all of these things are really important. And the more research I do, the more I find that you could eat right and exercise, do all the things, but if you don't have the support within your community, you're not able to manage your stress well, you're likely still going to have a number of different health issues. So addressing that. And so the thyroid is no different. The thyroid is impacted by our diet, our lack of movement or movement, right? It could be too much. Like I said, doing too much high intensity can be too much for our thyroid. But it's also impacted by medications that we use. So beyond the antibiotics and steroids I talked about in the beginning, and then the pill that we talked about a little bit later, it can also be impacted by things like ibuprofen and antidepressants and anti-anxiety medication. Really anything can impact your thyroid because it does need to process it. And so, so if you are finding yourself needing one of those things, so if you need an ibuprofen for the menstrual cramps, again, let's go back and address those, why you're having that, right? If you need, feel like you need an antidepressant, let's go back and address why you feel like you need that and what could be causing that depression. Is it the thyroid itself? Because that is something that I see all the time where, you know, patients get labeled with having depression and are given an antidepressant, but it turns out their thyroid was underactive the whole time, which will lead to depression, right? So if we address the hypothyroidism, that's when we can start to see benefits. And now they're not experiencing this neurochemical depression, right? There's always going to be situational things that happen, but they're not experiencing a neurochemical depression. And that's what we want to get out of. So the one food or one type of food protein that actually affects your thyroid more than any other type is gluten. And so I know there's a lot of like, you know, things that out there where so many people are going gluten-free, but if we consider how, you know, how many percent, I forget, it was like 1 in 5 women have hypothyroidism, then 1 in 5 women would probably benefit by removing gluten from their diet, because that is the one protein that has been studied that negatively affects your thyroid gland. And so that actually contributes to something called molecular mimicry, which essentially is the gliadin protein in gluten will essentially act like your thyroid hormone. So it looks a lot like your thyroid hormone, but it isn't, obviously. It looks a lot like it. So your thyroid receptors will actually take it in thinking that it's your thyroid hormone. But then what happens is it goes into the cell, and then the rest of the cell realizes like this is a foreign invader, calls a code red, and now your immune system attacks your own cell. And that's when we'll have the autoimmune type of hypothyroidism. And so, so I did want to mention that is one really big thing, that if you've already been diagnosed with hypothyroidism, or you know, or you even suspect it, might be helpful to remove gluten from your diet temporarily, just to see how you feel, because likely you'll feel better.
So reduce gluten in your diet, be open to change, and in general, just increase, look at the root cause of potential thyroid issues in your current lifestyle and adjust it. And so as we like to close off our conversation with our rapid fire questions. So the first question for us to you is, what is the worst health advice you've ever received in your life?
I feel like just eating low fat in general is very terrible advice. Or eating artificial sweeteners. I feel like people say that diet is better, but they actually significantly also affect the thyroid, which is definitely something that we've been talking a lot about. But also impact your insulin levels and blood sugar in general. So yeah, I would say those two things, like how artificial sweeteners are quote unquote better, and low fat anything. I'm a huge proponent of eating a lot of healthy fats.
That's a good one. And the second one is, if there was one habit we should all adopt today, what should it be?
After everything I said, I think I'll say meditation. Actually, we didn't talk about it at all, but I think that's the one thing I feel like everyone, no matter what your situation is, what's going on in your life, I feel like everyone can benefit from meditation. And with that said, I will just, put the caveat that it is a practice. And so I know there are people who are like, I can't meditate. It's too hard, or I'm bad at it. And I'm like, you can't be bad at it. You just can't. It's a practice. And so just practicing it, and just the act of practicing it has been shown to help improve neuroplasticity and just help reduce stress in general. So, which can of course help everything. So that's why I would say meditation.
Yeah, I think it's the common denominator for all this, be it more conscious, being open to change, eating more consciously, and listening to your body, listening to those signals. So yeah, I think that's a great one. And the last question for us, for you, is if you were to put a song, or a soundtrack to your life, what would it be?
I like this question. This is good. I think it would be "Feeling Good" by Nina Simone. Michael Bublé did he did his own version of it, which may be more popular, but I really like Nina Simone's version personally. I don't, do you all know her?
Yeah.
Yeah.
Her voice, and I mean the emotion and the rawness in it, that's just it's so beautiful.
It really is. And I think that's what it is, like the soul in it, like you said, the emotion, like it feels so raw. Like I would say that's probably it. And that's actually ironically, the soundtrack to my podcast too. So going into my podcast, I have a remix version of the Nina Simone song.
I've heard it before.
Yeah.
Nice.
Yeah.
Nice.
So, and that's why it's there, because I feel so deeply connected to it.
Nice.
Cool.
Awesome. Well, thank you so much for that, Hanisha, and thank you for sharing your insight on hypothyroidism. Hopefully, we can help some women start their journey into healing that, if they have that.
Definitely. I hope so too. Yeah.
Thanks for being on the show.
Thank you, Hanisha.
All right, thank you all. And I will just end by saying that, we talked about a lot of things, but it really is important to work with someone who knows your individual health. And so these are great places to get started, but it's so important to have someone who can go over this lab work with you and go through these things with you. So definitely reach out to a naturopathic doctor or integrative doctor who understands how they can support you, if this is a part of your journey or someone you love's journey.
That's a great disclaimer. Thank you.